Yehuda Herschman. I'm a neurosurgeon here in Palm Beach County, part of Palm Beach Neurosurgery. And today we're here to talk about SI joint pain and the treatment for it using the SI bone system. The anatomy of the SI joint is the joint that links the pelvis and ilium to the sacrum, which is the lowest part of the lumbar spine. Unlike other joints, this joint is not typically mobile. SI joint pain is caused by typical degeneration of the SI joint. It could also be trauma-related or arthritis of the joint. Any and all of these can cause SI joint pain. Often it's low back pain that may radiate into their gluteal area, down the lateral portion of their thigh, down the back of their leg, or even particularly to the groin is very, very common. When I see patients who have sacroiliitis or SI joint pain, oftentimes they'll complain of pain when sitting for prolonged periods of time or pain when standing for prolonged periods of time. SI joint pain is a common problem that patients may have, especially when they're complaining of back pain and even back pain that may radiate. Roughly 15 to 30% of those patients, their true underlying pathology is the SI joint. This number increases to those patients who've had lumbar spine surgery already to 40 or 43%. It's critical to know what the underlying cause of the pain is in order to appropriately treat the patients and avoid unnecessary procedures and or surgeries. When working these patients up and considering that SI joint pain may be part of their underlying symptoms, it's critical to obtain their history in order to figure out the particular details of what aggravates their pain, what makes it better. On examination, you'll want to test a Fortin's finger, Faber maneuver, thigh thrust, Galen's maneuver, as well as compression and distraction of the pelvis can be very helpful in helping to further your diagnosis and suspicion. This can then subsequently be confirmed with an SI joint injection. And upon completion of the injection, patients either immediately and also later may find that they have significant pain relief of their SI joint pain. Once confirmed that SI joint is their typical pain, there are a number of modalities that can be used to treat patients for their SI joint pain. Physical therapy, NSAIDs, as well as sometimes opioids. Can also try lidocaine patches over the affected area. Other things can be considered are further injections periodically that may help if they are lasting for more than a few months. And lastly, can also consider radiofrequency ablation of the SI joint. Once patients are confirmed that SI joint is the primary source of their pain, but have also failed conservative therapy, those patients may want to consider and may be good candidates for an SI joint fusion. The iFuse TORQ procedure is a minimally invasive procedure that allows me to place 3, sometimes 2 iFuse implants through an incision roughly 2 to 3 centimeters in length. It is a short procedure taking about an hour. Most of these I do in the surgical center where patients go home the same day. These 3D printed titanium implants that mimic cancellous bone that are placed across the joint. It allows for immediate stabilization of the joint. If patients find that many of these symptoms sound very similar to what they're going through, we'd be happy to see them here in our office to thoroughly evaluate them and get them on their path to treatment for their SI joint pain.